All right, I am Oliver Brooks, MD. I am presently Chief Medical Officer, Watts Healthcare Corporation in South Los Angeles, here at the NMA Annual Convention, our 121st Annual Convention. I am the 120th President of the National Medical Association, installed in 2019, about 6 months before the whole world changed with COVID. Happy to be here. I came up from being a pediatrician working in Oakland, moved down to LA, started as a staff pediatrician, then became chief of pediatrics and associate medical director, chief medical officer, short time CEO, now CMO also. Through the NMA, a number of offices at the local and the state level, and then did the president thing. So that was good. It's a lot of pressure under COVID, canceled our convention. We did everything virtual. Mine was the first virtual convention, and I will say I was proud that I had Stacey Abrams and Anthony Fauci as part of my faculty that presented information. So here we are now, 2023. COVID seems to be fading into the background. However, it's not. It's lurking in the background. It's just waiting for the fall to come. One of my other roles is as a voting member for the ACIP, Advisory Committee on Immunization Practices. It's a committee of the CDC, Center for Disease Control, and we determine and make recommendations for all vaccine policy in the United States. So one of the main activities we've done over the last number of years is review and approve the COVID vaccines. For those that are a little wary or hesitant regarding safety concerns, there was a vaccine, the Janssen or the J&J, that we actually pulled off the market because we found a link with having blood clots in women. It's back on the market, but it has a black box warning, so that's there. So I want people to understand, we don't just rubber stamp. If we don't like it, we send it back. That vaccine is not for us. Right now, there's coming an RSV vaccine, respiratory syncytial virus. It's a deadly disease to seniors and to children, or excuse me, infants, actually. As a pediatrician, as a trained pediatrician, RSV was one of those conditions we hated to see. So now there is a vaccine. Right now it's been approved for seniors 60 and up. The recommendation now is called shared decision making, which means it's not a full recommendation. You walk in, you get it. However, our people, African Americans, are more likely to suffer an adverse outcome from an RSV infection. So I am a full advocate, and anyone that I see 60 and up that's African American, I will make a strong recommendation for that particular vaccine. We got to talk today about 3 vaccines, so the triumvirate of infection: influenza, COVID, and RSV. Those are viral infections. They generally come in the wintertime. So what is this, July? 3 months from now will be October. We're going to be sitting in the thick of it. The key is there's a vaccine for all 3 of those, and do not get vaccinated at your own peril, okay? Our techniques of making vaccines are so good now we can tailor them. We can just have precision vaccines. So we're going to tailor the COVID for what we think is going to be circulating, flu for what's circulating. Next year we're going to change it or maybe not change it. But we have that ability to do that. So don't look past these biotechnological miracles. You know, we know about this experiment from the U.S. Public Health and the city, the institution of Tuskegee. But you know that we were denied treatment for syphilis in those days. Now we have a treatment. So don't tell me I'm not going to get what's going to save my life because of what happened in Tuskegee. We were denied the thing that would save our life. So now we're being handed it. Don't turn it away.
Dr. Brooks, how can we become better health advocates for ourselves and our families?
As it relates to being self-advocates, and for me, an advocate for my patients, the first thing to remember is, and a primary focus of the NMA is, the fact that African Americans suffer disproportionately from everything that is bad, generally speaking, and have lower rates of everything that is good. So I often get the analogy, if you got, you set a restaurant reservation at Commander Palace a month ago for 6 o'clock, and you showed up there at 6 o'clock and they said, we don't have your reservation, you'd be stomping your feet. You'd be putting on your jacket, as we would say. So if you're gonna go and deal with issues related to your health, your life, when you go in there with that same attitude. I need the advice, I need the medication, I need the referral, I need the understanding. And do not walk out of that doctor's office or wherever you are accessing your health care until you have what you need. You should have your own doctor, as opposed to saying, the doctor said. It should be Dr. Abraham said. See, personally, have a personal relationship. And do a little Google search. Spend 10 minutes on whatever you're worried about. You spend 10 minutes looking up who the next Kardashian is, or, like the housewife. Spend that 10 minutes on your own health. So I would say elevate the concept of your health, your wellness, to a high level so that you have an understanding of it. And then when you go in, you more or less know where you are, and you will get the respect that you deserve.
That's good. Last question, Dr. Brooks. For those watching now, somebody young may be thinking of going and being a physician, or somebody older may be thinking of switching careers into the medical profession. What would you tell him or her looking right now?
First, I would say that a beauty of being a doctor is that you learn the science and the structure of the most complex organism on the planet. So that's something that people don't often think about, but I know more about the human body than 99.9% of the people on the planet. And that knowledge in and of itself makes me feel good. I would say that if you're looking to go into medicine, you have to have compassion. You have to care about your patient. When I have students, I say the first thing is you got to care about that patient. If you really don't care about that patient, if you don't really care about their outcome, you don't care about their family, you care about their overall well-being, you will not be a good physician or other healthcare provider. Lastly, I would say you have to have true dedication. You are not handed an MD degree, you earn an MD degree, and that has not changed. But at the same time, there's nothing in your way other than yourself. So if you really want to be a doctor, if you really want to care for people's health and wellness, you might as well say you're already there. Because the only thing that will stop you is yourself, and if you get out of your own way, you will achieve it.
That's why he's Dr. Brooks, ladies and gentlemen. Thank you for joining us, sir, and thank you everybody for tuning in to the 2023 National Medical Association Conference. Thank you guys. Talk to you soon.